So I'm just going to briefly cover some advances in novel technologies for patient monitoring and cover some things that I think would be useful in a range of specialties, but will focus on cancer care. So if you look at the amount that healthcare systems spend, I mean, the UK healthcare system is a very economical one. You know, in 2012, we spent about $3,000 per capita and around 8% of our GDP, which is, you know, minute compared to, say, the US, but it is still a significant expenditure, and these curves have continued to rise. So the cost of delivering care is ever increasing. And the place where we deliver care has also changed substantially. So if you look at the number of hospital beds in the UK, in England, between 1979 and 2012, there has been a substantial drop. Now, the majority of those have been in places like, you know, mental health, but, you know, we've got geriatrician here, geriatric beds have reduced, acute medicine beds have reduced. So what we're doing is we're providing more expensive healthcare to patients. There's more healthcare to provide, but less and less of it is being provided in a hospitalized, monitored setting. And I think that's something that most people would acknowledge. Now, if we then look at something very current, which is the NHS 5-year forward view launched by Simon Stevens in 2015, there is a clear driver within the NHS to partner technology with healthcare and come up with innovative ways of delivering healthcare. And part of that is because of the need to deliver it outside of the hospital environment. Wearable technologies have been singled out as a key enabler. And to quote, you know, the digital revolution is transforming our lives in many sectors, but the health sector is lagging in reaping the potential rewards. So, you know, and I think that would resonate with most people in that their personal lives, their phones, their computers, the sensors that they use in their day-to-day lives have really moved on. But in healthcare, we're really stuck in old times. It is something that we have witnessed. So I'm just going to go through some of the key enablers and what's been going on. So computer miniaturization is something that we've witnessed. It's been staggering. And this essentially shows on a graph how how computers or processors have reduced in size over time. They've roughly halved in size every couple of years, and that miniaturization has not shown any signs of slowing down. So what currently is possible, what currently is happening will continue in all probability to happen. And that's very important because when you combine powerful computing with miniaturization of sensors, I mean, here we have a implantable pH sensor that, you know, is millimeters in size. You've got microneedle arrays for glucose testing, which are being piloted and tested for diabetes care. And then you've got this concept of integrating sensors with processors to close the feedback loop. So here, for example, you can see an externalized wearable pancreas, essentially. You've got your insulin delivery and you've got your glucose sensing on the patient, delivering the therapy continuously. And what enables all of this is, of course, wireless technologies. And wireless technologies have moved on hugely. Wireless networks are widely available. It is now possible to get that information to wherever you would want it through mobile phone networks or wireless networks in areas. But there are also body sensor networks that have been available for use for a number of years. This is an example of that. It's a product called CardioNet, where patients wear essentially 3 ECG leads connected to a computer, which then sends that information to a mobile phone type device, which then sends that on to a monitoring station. And this is something that's been around for 10 years. But that miniaturization of wireless technologies is, and the fact that these wireless technologies require less and less power means that we can now get that information out to where we need it more quickly. Then there's the area of wearable sensors. This is something that was developed. It's called the Mithril project, or Mithril. It's set up at MIT, and it was a wearable, sensor really, and contained onboard processing. You can see what it was like, and over the following decade, further projects in Europe then resulted in miniaturization of and if you like, incorporation of these technologies, fabrics that can have circuits woven into them, and then that has now translated into what is available through the internet. Ralph Lauren is selling a wearable shirt which gives you your continuous heart rate monitoring if you want it, and if you want to extract it, as well as an activity monitor. So these are all areas where technology has moved on, and we can think of healthcare applications for these technologies. So the future really is here, and this concept of a tricorder in Star Trek that Bones would hold and run over someone and get all the information that he needed off of them, is something that most people would now think is possible. So how do we do that, and how do we put that into practice? Well, here are some examples. You'll obviously all have, this will hopefully stimulate areas where you can think these technologies can be used. But I'm going to sort of focus on the cancer theme and some scenarios where this monitoring can be used. So for inpatient care, we know that we use very standard, basic ways of monitoring patients. That's clinical history and examination, observations like their heart rate, respiratory rate, saturations, temperature, blood pressure, parameters like urine output, fluid balance. There are scoring systems in hospitals like Muse scoring systems that highlight which patients are at risk. But ultimately, these are very labor-intensive systems that require people to take multiple measurements and then subsequently raise alarms. And they are, if you like, as good as the frequency and with which they're done, and the people monitoring the patients. So there is quite variation in the standard to which these are provided. And there is now a device that's available. It was developed here at Imperial by a group led by Chris Tomazu. It's been commercialized by them, and it's called Sensium Vitals. And what it is, it's a single patch which lasts 5 days and sits on the abdomen, on the chest, because that's where they essentially have two ECG type leads that pick up heart rate. They're able to measure respiratory rate. It has a extension that goes under the arm with a temperature probe. And what makes this device, if you like, a step change in wearable technologies is the fact that it's an ultra low power device that lasts about 5 days, and it costs about £15. And so these can be used, put on every patient, and then discarded. It's FDA cleared, it's CE marked. I don't have any commercial interest in the technology, but what this shows is that it's already out there. The question then is, what do you do with all the information that this technology generates? Because it pretty much tells you everything you want to know in terms of these parameters with regard to these patients at any one moment in time. The question then is, how do you respond? And that's a different question. I'm a surgeon, and I'm interested in post-operative or peri-operative monitoring, and a lot of my work before I moved to the Christie was on post-operative home monitoring and developing novel technologies for that. And here, I did my PhD here at Imperial. We developed an ear-worn activity sensor that had 3 accelerometers in it, very much like your iPhone would have, or devices like the Nintendo Wii would have. And what these did is these gave us an ability to tell what the patient was doing positionally and in terms of their activity over the course of the day, because it collected that information. It stored that information on the device, and then it would send that information off wirelessly. And for a healthcare application, what we did is we added a pulse oximeter And we ran some trials on that where we would we would ask patients who'd had surgery and gone home to wear these devices. We would install, at that time we had to install the Wi-Fi in their houses because people didn't generally have Wi-Fi in their houses. That Wi-Fi would then extract the information, send it to a central server where it could then be monitored on a daily basis. And what we did is we learned a lot about the hostile home environment, the impact of people's social habits, their pets, etc., on asking them to wear these sensors. But what we did get is some very valuable data on how you can demonstrate post-op recovery in a way that you currently can't. I mean, currently a patient goes home being discharged, they're seen in clinic, and you say, well, how are you doing? You okay? You eating well? Great. And you really don't have any idea of what's happened between the time they've gone home and the time you've seen them in the clinic, say. But here you can see that, what you can start to do is measure the levels of activity of different patients. You can see that preoperatively, this patient had very high level 2, level 3 activities. You can see that from the first day they went home, so that's post-op 1 is the first day they went home, not the first post-operative day. You can see that there has been a dramatic change in their mobility, and what you can then start to see is a pattern of recovery to normal. And what you can then start to do is plot recovery curves, figure out when it is that you're more concerned about people when they're not progressing. And say in an elderly population, long periods of not moving around generally signifies that there may be something wrong. And there are many technologies that are looking at that space. Another area that is of great interest is the area of prehabilitation. So that is optimizing physical, nutritional, and psychosocial aspects of patients' health before they have surgery. And we have seen that there has been a massive expansion in the use of activity trackers and wearable technologies in the if you like, health and leisure market, to the point where there are now hundreds of manufacturers that produce devices that will help you measure how healthy you are. And there is an application, we think, for these technologies, particularly in the area of prehabilitation. The advantage of these technologies is that now that you walk around with a mobile phone, a smartphone, you get that feedback on a daily basis. If you can close this feedback loop and tell people that they should do something differently, they can then do that. These devices also become a means of interacting with the patient. They become a means of logging people's information, their diet, how they're feeling, etc. And it's a way really of keeping a track of them, even if all they do is just interact with these devices in a way that hasn't previously been possible. And at the Christie, we're interested in this area, so we're looking at prehabilitation. And when we started looking at how we could set up a prehabilitation program for our patients and how we could deliver this through technology, just 3 or 4 months ago, we found 347 technologies that you could to use and that you could use for this purpose. And as we whittled them down on on the basis of what we needed them to measure, but also on what was available and compatible with devices, we found 3 devices, and you can see that the cost of these devices, these are the commercial prices, these can be lower if you buy them in bulk. It's not substantial, and these are ultimately reusable devices. In time, these could be disposable. What we wanted is something that measured heart rate, step count, distance, and gave us some idea of the quality of a patient's sleep. And then others had a few extra features that would help. So, for example, if you were interested in temperature, there is a device that can measure temperature. So that's a piece of work that's currently in progress. Another area we're interested in, and Mark is involved in this project as well, is looking at monitoring patients on systemic chemotherapy. And patients on systemic chemotherapy can have a range of complications related to the drugs, the toxicity, neutropenia, etc. And whilst there are systems to keep an eye on people, which are very labor intensive and largely rely on either patients presenting to clinics or being called and phoned and asked how they're feeling, ideally what you'd want to do is you'd want to sort of have this home monitoring system on the left, where you could ask a patient to plug themselves in and tell you what they're going, and find out how they are. But the reality is that that's not something that somebody is going to do on a regular basis. And the question then is, can we apply these wearable technologies to monitor patients on systemic chemotherapy so that we could then set up a system of early detection of those patients that were running into trouble? And that's an area that we're currently working on. And the advantages in this area is that you can use these technologies as a monitoring platform. There are already a number of commercially available devices. So if you buy, for example, a Fitbit already have a platform that they've developed for companies to monitor multiple Fitbits. So you could have 100 Fitbits worn by patients, and you could start to develop your application for those 100 Fitbits, and you could start to use the monitoring platforms that the companies already have made available to you to then tailor them and ultimately pay for the software that you need for your patient group. So that's just a brief insight into the space, and that's it. Thank you.
Thank you. Well, thank you. That's very interesting. Any questions there for Omar? Yeah, at the back.
Thanks, that was fascinating. Are there any technological solutions to monitoring adherence to tablets that you can advise?
Yeah, I mean, there are people who have actually, there's a group that's actually developed a sensor that can, if you mark a pill and you put it on the patient's chest, it can count the number of pills as. So what you have to do is you have to build into that tablet a certain technology that can be swallowed, and every time that passes that sensor, it can do that. You can also pick up drug compliance through picking up metabolites in urine, for example, and stool. So toilet sensors is another way of looking at that. And then of course there's diaries and reminders and various things that, I've got patients who have a number of reminders on a number of apps that they have to just tell them to take their drugs, and they just adhere to them. When they do that, they press a button, and that's a very simple way of doing that.